This is a Fox News Alert. I'm Brett Baer. We are getting our first look right now at long-awaited Republican legislation to repeal and replace Obamacare. Details are being released as we speak. Coming up shortly, I'll be joined by the two House committee chairmen who will be leading the efforts to get this bill to the floor, each in their respective committees dealing with one of the two parts of this legislation. It is a bill that, unlike Obamacare and its 2,400 pages, is only about 120 pages total. We start with exactly what Republicans are proposing. Chief Congressional Correspondent Mike Emanuel is live tonight with the breaking details on Capitol Hill. Good evening, Mike.
Brett, good evening. That GOP blueprint is being posted this evening. Separate components from House Ways and Means and Energy and Commerce working in conjunction, and GOP leaders say it is time to deliver.
Americans need relief. They deserve a new direction. That's why we're taking action to repeal and replace Obamacare with health care solutions that can actually work for the American people.
Tonight, HHS Secretary Tom Price and Budget Director Mick Mulvaney are expected to have dinner with President Trump to review the proposal, with Mulvaney as a founding member of the House Freedom Caucus seen as critical to winning over the conservative wing. The Ways and Means proposal calls for dismantling Obamacare taxes and mandates, expanding health savings accounts, and providing a monthly tax credit to people who don't receive insurance through work.
What the president's goal is to give people choices, to let them purchase the kind of insurance that they want for themselves and for their family, not what Washington forces them to buy. This is a real important distinction between where we are right now in that individual and small group market and where we want to go.
The Energy and Commerce Plan calls for a patient and state stability fund, giving states flexibility, responsibly unwinding Obamacare's Medicaid expansion, and strengthening Medicaid. Some of the discomfort has come from the tax credit concept.
There is a big divide between, in essence, the conservative camp within the caucus saying we feel uncomfortable at this point with the idea of a refundable tax credit, and other folks saying, wait a minute, this is a way of funding an HSA, a health savings account that would be applicable to everybody.
And Maine Republican Senator Susan Collins has warned Republicans are not unified.
There is not a consensus. It is very complicated, and we shouldn't rush it. We need to get this right.
Even before its release, the GOP's plan was under attack from the Senate's top Democrat.
They don't want folks to see it until the very last minute. Just rush it through. I don't blame them. It's going to be very hard for Republicans to be proud of this plan.
Lawmakers are just now getting a look at this GOP health care blueprint. The House Ways and Means and Energy and Commerce committees are expected to work on the package later this week. Brett?
Thanks, Mike. Now a special report exclusive. We go behind the scenes to see how Republican lawmakers will manage the legislation through the often Byzantine approval process. And we'll talk specifics. Joining me tonight from Scottsdale, Arizona, is House Ways and Means Committee Chairman Kevin Brady. And from Capitol Hill, House Energy and Commerce Committee Chairman Greg Walden. Chairman, thank you for joining me. Let's start and break this up. There are two committees here dealing with two parts of this legislation. Chairman Brady, let me start with you and Ways and Means, and I guess the tax part of this equation.
Yes, so it has been 7 years since Obamacare was passed into law. It is collapsing. It has hurt more people than it's helped. And so tonight we deliver on President Trump's promise to repeal and begin replacing it with two big principles. One, to restore state control of health care, get it out of Washington, and also to restore the free market, so give individuals the power and the freedom to choose plans that's right for them. That second part is in the Ways and Means area. So we begin by repealing the awful taxes, the mandate penalties, and the subsidies in Obamacare, and to give Americans the freedom to buy plans that they need. That includes nearly doubling the size of the health savings accounts and make them more usable. That's good for the out-of-pocket costs. But we give them a tax credit immediately usable that ranges in price from $2,000 to $14,000 a year, depends upon their age and their family. And with that, they can buy affordable plans that are approved and certified in the state that they're in. And these are plans that they need and can use, not the plans that Washington's been dictating to them.
How is this, Chairman Brady, not Obamacare light from your perspective?
Yeah, it is Obamacare gone, because we repeal all those taxes, those mandates, those subsidies. There's nothing left there. And instead, we give them the same tax break that we give workers at big businesses. We give that same tax help to small business people, those mom and pop businesses, workers at small businesses, even those entrepreneurs and families in between jobs, the ability to buy a plan that's right for them. And I think maybe most importantly, we're giving Americans a freedom who haven't got health care at work, and they don't have in a government program freedom like they've never had before to buy health care that's right for them. So this is clearly Obamacare gone and new freedom.
And Chairman Brady, last thing on this is, are the tax credits means tested?
We focused on, obviously, we want to make sure that as you get older, your health care premium increases, or your tax credit increases. And also as your family expands, we want it to expand with you as well. And so we focused it really on the low and the middle income families who don't get health care at work. This is really important whether you're a young person starting, just leaving school and your parents' health care, whether you're a small business person just struggling to make ends meet, or you're a retiree who's worked your whole life and there's a few years left before Medicare. This really fits what Americans need.
All right, Chairman Walden, you're dealing with the energy and commerce legislation and basically Medicaid and what happens with Medicaid.
Well, Brett, when we repeal and replace Obamacare, it will amount to the biggest entitlement reform probably at least the last 20 years, certainly since the Clinton days when they reformed welfare. And what we want to do is restore power to the states, put Medicaid on a budget, and get back to where you have a doctor-patient relationship in health care and in the individual insurance market, which, as you know, as you've reported on, is collapsing all around us. 1 out of 3 counties, patients have one choice for an insurance plan. But let me make clear a couple things we're going to make sure. We're not pulling the rug out from under people. We're not going back to the days where those with pre-existing conditions were penalized or could not access health insurance, and not back to the days of lifetime caps or allowing your kids not to be on your insurance until they're 26. Those protections stay as we reform Medicaid and get it on a budget, get it back to the states. And let me give you one example, Brett, that I think says it all. Governor Herbert from Utah petitioned the federal government to be able just to communicate by email with his Medicaid recipients who had email. 9 months later, the federal bureaucrat said he couldn't do it. By email, they told him that. That would have saved his state $6 million. This is the kind of thing that makes no sense, drives up costs. We want to get back to where our governors and our states and our local governments can innovate with those most in need, those on Medicaid, make sure they're properly cared for, and that we get waste, fraud, and abuse out of the system.
Now, this includes pre-existing conditions. It includes keeping your child on there till 26?
Yes, indeed, and no lifetime caps. We think those are all important provisions. Those were, frankly, in many cases, Republican provisions long before there was an Obamacare. I worked on some of these issues way back in the 90s when I was in the state legislature because, you know, health issues don't look at your voter registration card. They just hit your family. And we want to make sure those most in need get the care they deserve, are not excluded just because you have a pre-existing condition.
Well, Chairman Walden, as you make this shift, if this all passes, how do you avoid a drop in the total number of those insured?
You know, I think we'll restore the markets. Right now, the biggest threat is that the health insurance market itself and the individual market is collapsing. We've seen rate increases of 25%, 27%. I get letters all the time from people saying, I can't afford what they're selling. And if you look at the individual mandate and what it's done in that market, 2/3 of those say they're going to pay the penalty or get a waiver. Only 1/3 signed up for Obamacare insurance. It's out of whack. It's not working. And as the CEO of Aetna said, it's in a death spiral. So what we want to do is create a market that's affordable and available and that works in partnership with what Chairman Brady's doing on the tax credit side. We think we can get there and we can get coverage back into the marketplace that right now is collapsing.
Yeah, Chairman Brady, I want to turn to you. Where do you think the biggest pushback, even within your own caucus, is going to come from? I know you're pitching this and the whole bill goes out tonight, but honestly, you can't lose more than 21 votes in your caucus to get it through the House, let alone what you're going to face in the Senate. Where do you think the biggest pushback comes from?
Well, I am confident we are going to pass this and deliver on President Trump's Trump's promise to repeal and replace. Look, these policies have passed the House a number of times in the repeal area. The replacement are long-standing Republican policies of giving control back to the states and to the individuals as well. We are making sure this is fiscally responsible as well. So I see all the elements are there. We've been listening very carefully to our Republican members for months now, and over the weekend as well, to make sure we get it right for them. So the changes you see in this legislation that's online tonight and available for Americans to read, I think are exactly in the right place.
But for conservatives, are you willing to, is the leadership willing to kind of use the political capital here to bring conservatives over? And then you have the debt ceiling, possible government shutdown battles, the tax reform issue. Is Chairman Brady, is the political capital going to be used on this?
Yes, it is, and it should be. This is one of our key promises as Republicans. We know we can do so much better than Obamacare, and I think the proposal we lay out tonight in that step-by-step basis, which is just the opposite of the Affordable Care Act, is exactly what the American people need, and I guarantee you House Republicans are going to deliver for the president.
Chairman Walden, final word here. Are you confident that this bill brings costs down?
I think it will, especially in combination with what Secretary Price can do at HHS. A lot of power over there to turn the levers, pull the levers and turn the dials and get real reforms in the market, restore to the states the ability to make some of these decisions. We've reached out to the states. They've said, please, please, a one-size-fits-all doesn't work for our states. This is part of why our markets are collapsing. So I think in combination, the answer is yes. And I think we're going to get this done. We're proud of our product. It's online now. People can read it and give us their feedback. We'll have an open and transparent markup in the very near future.
Chairman Brady and Walden, thank you very much.
Thank you, Brett.
Thank you.
Meantime, President Trump has signed his second executive order instituting a travel ban for potential immigrants, and there is a lot of finger pointing going on tonight over the president's